Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
What are the conditions where medullary carcinoma of thyroid is suspected? Medullary carcinoma of thyroid is suspected in conditions like uh, first, whenever the patient presents with high levels of calcitonin and also high levels of carcinoembryonic antigen. In such cases, we should suspect the medullary carcinoma of thyroid. If the patient has cervical lymph nodes, if the patient has cervical lymph nodes just at the presentation itself, if the patient has cervical lymph nodes, even then we should suspect the medullary carcinoma of thyroid. So presence of cervical lymph nodes at presentation, or if the patient has diarrhea at presentation. At the presentation itself, if the patient has diarrhea, even then we should suspect medullary carcinoma of thyroid. If the patient has amyloid in the stroma histologically, that is, if we do a histopathological examination and if we have found that the patient has amyloid histologically, then uh, we should suspect medullary carcinoma. In presence of men, that is multiple endocrine neoplasia. That is, how do you suspect multiple endocrine neoplasia? It is suspected if the patient has a family history of pheochromocytoma or family history of hyperthyroidism in the patient, in the family of the patient, or family history of thyroid. Then we should suspect that the family has multiple endocrine neoplasia and thus medullary carcinoma of thyroid is suspected. If medullary carcinoma of thyroid is suspected, in such cases, always we should do family surveillance is advisable in such cases. Family surveillance should be done during that cases.
thank you and thank you for watching.